Hello and welcome to my presentation. My name is Antonio Carrico. I am a traditional naturopath, also the founder and one of the instructors and one of the owners of the Institute of Natural Health and Education School of Massage Therapy, and also one of the practitioners of the Carrico Therapy Center. Myself and my wife, Melissa Carrico, we both are the owners of the Massage Therapy School and both working at the Carrico Therapy Center. So today's presentation is going to be all about hormones and massages. So I'm going to get into a little bit how massage actually uh, influences the hormonal system, or also called the endocrine system. So give everybody a little bit of more an idea how massage can actually benefit your hormonal system and balance your moods, your emotions, and etc. So, you know, an overview of the presentation for today is going to be a little bit about the endocrine system. I'm going to be talking about what the endocrine system is in a very simple way. Also, physiological effect of massages. How does massage actually affect and changes how the hormonal system operates? Um, and when the hormones are released, what exactly happened? How did massage actually end up changing the way hormones are uh, generated and released? And in general, the health benefits of massage therapy. So, on the overview of the endocrine system, and a very simple way to understand that for anybody that is watching this presentation would be that the endocrine system are composed of glands. There are a lot of different glands that will make the endocrine system, such as the pituitary gland, the adrenal glands, the thyroid that people probably more familiarized with, pancreas. So all of those glands will then be involved with the secretion of a specific type of hormone that will do different things within the body. Now, um, a lot of the hormones will have different functions. Some hormones will be regulating your metabolism. Other hormones will be involved with growth and development. A lot of times, like the growth of a new hair, new nails, repairing your skin, all of those things. Repairing an inflammatory condition. You twisted your ankle, you have a problem that needs to be repaired. So all of those are influenced by hormone released. And overall, at the very end, what the endocrine system is going to try to do together with other organ systems, it will be to balance your body, to bring your body back to more of a balanced state, more a equilibrium when it comes to health. So that in that case, we use that word as homeostasis for balance in terms of health. Now, the regulation of the body process is done by hormones. It's a combination, and hormones will be working with other organ systems, and then hormones will be behind of how much energy you have, how fatigued you're gonna be. Okay, it's very much associated to the reproductive system organs and functions. It controls your mood in terms of controlling anxiety, depression, and so on and so forth. Hormones, depending how it is, it can improve. Some positive hormones can improve your immune response. Other hormones will actually put a little bit of a hold on immune response or decrease the function of the immune response. So hormones are very, very much associated to a lot of those bodily functions. And on the overall hormone feedback helps to maintain internal stability of the body and bringing you back from a state of imbalance to more a homeostatic or state of balance. This what hormones will be doing. Now, when it comes to stressful situation or exposure to stress, uh, then the opposite will be the relaxation part. So let's talk about two major things here. So let's talk about stressful hormones, for instance. One of them would be cortisol. Cortisol, which is one of the anti-inflammatory hormones, it gets released during the time we are exposed to stress. So also it gets released when you have an injury or you have the need of an anti-inflammatory. Now, a lot of times the body doesn't actually has to wait for you to have an inflammatory condition to release cortisol. If I get stressed right now, my body will release cortisol. And the reason for that is because my body wants to have cortisol available in my bloodstream, just in case I am stressed and I do something and hurt myself. So immediately I have the availability of cortisol. So, and that's what happened between chronic and acute stress. During the acute stress, which is important, what you're having right now, watching this presentation, maybe taking notes, things like that. So you're more physically active or paying attention. So that is more of an acute level of your state of physical state. So meaning that you are ready, you're paying attention. So and the same thing happen is if you have to take care of immediate situation that happen. So you have to increase that kind of bodily function, and that would be more of a state of acute stress. And a lot of times acute stress is okay. You need to get some form of acute stress so you can get things done. However, a lot of times people just prolong that state of acute stress and stay on a kind of a stressful level for a long period of time, turning that into a chronic level of stress, which is not an ideal thing for the human body. So when the body is in the long term of stress or under the influence of chronic stress, you have a constant release of cortisol and other stressful hormones that end up being a little bit more harmful to us than beneficial to us to take care of immediate situation. So hormones are very much associated to that. The other thing will be here. When you're relaxing or we are receiving massages, for an instance, your body immediately counteracts that level of stress by releasing oxytocin. Oxytocin then has been sometimes considered to be the lovable hormone, the bonding hormone, counterbalancing the stressful hormones. So in the long run, as you can see here, the endocrine system balancing those, if individuals were having or experiencing episodes of stress or exposure to long-term stresses. So, and then if you start getting massages, what happened is your body immediately starting to release some of those the oxytocin, counteracting and decreasing the release of cortisol. So it will be important in that case. So on the physiological effects of massage, which I like to touch into a little bit, will be different kinds of massage. There's a lot more than just what you have it on the screen right now, but a lot of times people are just very familiarized with Swedish massage, which is the relaxation massage. But before we get into this, I'd like to say something here when it comes to massage therapy and choosing this. And I'll be making a different video about how to properly choose a massage therapist, okay? Because to receive a massage therapy done by someone that is licensed, you have to really look into the person's qualification, not only being licensed, but also the educational background. Not all massage therapists are educated equal. So there are a lot of massage therapy schools out there, and some of them may not teach the same way that some other schools. They are really, really good and adept with their education. So really gotta have to know exactly if the massage therapist that's gonna be giving you a massage, it's well qualified and really knows what he or she was doing. But let's go back to this. Swedish massage, for instance, which is relaxation massage, right? Long strokes make you to relax. A lot of times people choose Swedish massage just for stress management, stress relaxation kind of type, stress reduction, which is totally fine. It's very beneficial. It helps with a lot of the counteract the stressful hormone, helps to release a lot of the other good hormones during the time you receive your massages. Now, the deep tissue massage, to me, is more of a clinical massage. It's not just pressing deep on the body, okay? So even a Swedish massage, a properly trained massage therapist can actually do a little bit of a deeper strokes within the Swedish. But in a deep tissue massage, which I consider to be more clinical massage, will be something like you go in to get a massage because you have a shoulder problem, a low back problem, a neck issues. So then the massage therapist will be providing techniques that will be more localized, will be more clinical application for that specific area to target specific areas. So, or a specific condition. So there's more deep tissue massage or clinical massage. On the fruit reflexology portion of it, of massage, which is very popular among massage therapists, since we have different kinds of reflexologies, we have a ear reflexology, you got a hand reflexology, you got a foot reflexology. Now, the foot reflexology is one of the most popular within the massage therapy practice. Now, for the foot reflexology, I always like to say that you also have to make sure that the therapist or the massage therapist is well educated on foot reflexology. It's not just like the person took like a 2-hour course or an online course and now is doing foot reflexology. That individual will have to have a deeper understanding between conditions that affected the feet, the leg, the lower leg, the feet, the relationship between areas of the foot and the nerve system and the endocrine system. So it has to have a little bit more of an understanding, not just knowing the mapping of reflex point and then provide pressure on it. Okay, so look into a little bit more, getting more information on the person's proper education and qualification. Now, the immediate response to touch when you're receiving a massage is done by it's not only associated to relaxing the muscles, but also is done by what we call receptors. We have different receptors within the body, receptors for pressure, for receptors for cold, for all different kinds of stuff, temperature changes, vibration, all of those receptors are within the distributed within the body, and then those receptors have the function to warn the central nervous system or your brain about the specific touch. So is that a pleasurable touch? Is that an uncomfortable, too deep of a touch, creating pain? So those receptors will communicate with the central nervous system, telling the brain, okay, this is what this is. So when you're receiving a massage done by a qualified practitioner that is kind of well received by your body or well received by your receptors, that information gets sent to the central nervous system, and then your brain tells a specific gland secrete good hormones. If it is a not very comfortable technique or not comfortable massage, then those receptors will send a different signal to your brain and say, hey, this is stressful. And then your body doing the massage is not releasing good hormones, but it's releasing cortisol, epinephrine, norepinephrine, and some of the other stressful hormones. So we counteract the benefit of getting a massage if you're not actually enjoying the work or the benefits of the work. Now, massage is just more than just putting lotion and oils and rubbing the body. Massage is backed up by a lot of scientific evidence when it comes to the benefits of massage for all sorts of conditions. So, but one of the few things that massage is associated to, and I like to point it out, one of them is increased blood flow. Massage provides this mechanical pressure within, over the body that actually pushes and accelerates the blood flow along with other bodily fluids. So it helps. A lot of times helps to decrease inflammation. It helps to decrease, can help to decrease like swelling. It's been used for lymphatic issues. So massage helps to increase blood flow and fluid flow. Now, the other thing that massage does very, very well, which is inducing relaxation, is to put the individual in a parasympathetic state. So let me explain parasympathetic a little bit without getting too deep into the nerve system. Within the nerve system, you have what we call the autonomic nerve conduction. Autonomic means that you don't have any control of it. So that autonomic nerve system, which is like associated to, for instance, an example here would be your heart rate, for instance. It beats even when you're sleeping. So you don't have to tell the heart to beat. So the body, the central nervous system is constantly telling, to conduct electrical impulse to your heart so your heart can beat. You breathing in and out. So that's the same thing as autonomic. So those are parts of your bodily function that operates without you telling those organs to do so. So that's autonomic. Now, the subdivision of the autonomic nerve system, it's balanced. It's balanced between something more hyperly active and low activity. So you have two things. One is sympathetic. Autonomic nervous system can be sympathetic or parasympathetic. The parasympathetic, if you imagine this, visualize the parasympathetic autonomic nerve conduction, it would be the relaxing phase of your nerve system. And the sympathetic is the one that you're having right now, paying attention to what I'm saying. So we get up in the morning, get ready to go to work. That's your sympathetic. And stress makes you to put you on the sympathetic. Now, massage or any other relaxation techniques will put you in the parasympathetic state, which is the relaxing one. Now, studies have shown already that the parasympathetic nerve conduction helps to speed up the healing process. Okay, so your body reacts a little faster, more efficiently with healing, and etc. So that's the parasympathetic. So massage is great for that. So, and some of the studies already shown that massage therapy helps to lower heart rate, lower blood pressure. All of those things happen because it puts that person in a more state of relaxation, which is the parasympathetic response. Now, the other thing is the mechanism between touch and massage and the endocrine system or the hormonal system. So as I was saying it before, within your body and under your skins, you have different receptors. Receptors are pretty much just to receive a specific information and send it to the nerve system or the central nervous system in your brain to tell the brain exactly what you're feeling at that moment. So this tactile input, this pressure, the vibration, that feeling, okay, it changes how the nerve system communicates with the endocrine system and tell the endocrine system, hey, secrete this hormone that it will be relaxing, or secrete this hormone that puts the person on the sympathetic, more alert part of the nerve system. Now, with that, it triggers some changes when it comes to how the endocrine system works based on what kind of massage you're getting. So one of the major benefits on that case will be the release of cortisol, right? So we talked about stress makes your body to release a lot cortisol, which is a part of one of the stressful hormones released during the stress, and also it's an anti-inflammatory. So what massage would do, put you on a parasympathetic state, it reduces the level of the necessity of releasing cortisol levels or cortisol. So the level of cortisol would decrease. So, and that is by helping you to balance and alleviate some kind of a level of stress during the time you're getting massage. So the promotion of relaxation, getting a massage, lowering cortisol will be extremely benefit for not only for physical benefits, but also for your mental balance. Now, as a opposite of releasing cortisol, massage helps the body to do what we call the counteract hormone of cortisol, which will be oxytocin. So that's the lovable hormone, the binding hormone, the feel-good hormone kind of type of thing, which helps to lower all the blood pressure, your heart rate and all the other little things, and it speeds up your healing process. That is actually achieved by putting the person in a parasympathetic state or relaxation state. Now, another thing here is serotonin and dopamine, which are the neurotransmitters of your brain. Those two need to be in a good balance in order to make the individual to feel more mentally balanced, not having or experiencing anxiety and depression and so on and so forth, having the feeling of happiness and balance and things like that, and overall the emotional well-being. So massage helps with that and enhances the dopamine, which is a neurotransmitter that communicates with your brain and tell you how to become a little bit more mentally balanced. Okay, so the combined effect of serotonin and the dopamine will end up boosting your mental state of health, supporting you during times of stress, makes you to feel a little bit more understandable, rationalize a little bit better, thinking before you act kind of type of situation. That is what serotonin and dopamine will do in a good balance, and massage will help with that. Now, the other health benefits of therapeutic massage will be uh, your physical health, for an instance. As you can see here in the picture, yes, it definitely helps to release muscular tension. Along with that, as we talked a little bit about anxiety reduction, uh, massage will help with that because massage will reduce this stressful hormone release, and oxytocin gets released, and then most of the time you have the individual finishing or at the end of a massage feeling extremely relaxed, be able to actually think clearly about different things, be able to respond a little bit better to different things, be more understandable with different situations. So all of those things is generally achieved after a massage session. Now, when it comes to the immune system, as I mentioned earlier, stressful hormones really put a little bit of a hold, and it slows down a little bit immune response because the body has to distribute this energy among different kind of bodily functions that are under the sympathetic state of response. So when you're getting a massage and you are inducing relaxation and putting the person on the parasympathetic state, which is the relaxing part of the autonomic nerve system, you end up actually improving your ability to heal yourself. So you improve your immunity in general, and that is backed up by research too. So accelerating like tissue repair, getting better from a cold or flu, anything else that your body needs to bring yourself back to homeostasis. Now, massage should always be implemented and put it together with other healthcare settings because it's a complementary therapy. It's not an alternative. It's just to complement anything else that individuals are actually having as a healthcare protocol. And that improves the patient outcome, the improvement of different kind of a medical procedure. And this presentation is not only intended to educate you, but also to allow you and maybe help you to educate healthcare professionals that are now well informed about the benefits of massage. So I think it's your body, so it's your responsibility. I think you have the power to also go to whatever practitioner you're going to and say, I really like to maybe experience a little bit massage therapy along with the treatment. I think could be beneficial to me. So there's nothing wrong with that. So inform yourself, read a little bit more about benefits of massage, and educate other people about the benefits. So an integration overall of massage therapy without healthcare settings will be extremely important. So overall, I like to say that this presentation was totally dedicated to explain a little bit about the endocrine system or the hormone system and the applications of massage. So what happens when you get a massage? What happens to your hormone release? What will be the beneficial effect of massage when it comes to hormone release? How is massage actually help? Massages will help to reduce stress. And also, how does massage actually connect itself with balancing not only your physical healing, but also your state of mind, your sense of well-being, your mood in general. So that was the intent of this presentation. I'd like to thank you for watching. And if you don't mind, I'd like to ask you if you can actually subscribe to this channel, like the video, and maybe share that with others. And then I will see you next time. Thank you so much.